Okay, that's brilliant. Now, I've got three documents on the screen, which I just want to briefly look at, taking you through. Now, the first document that you see on your side is going to be a document which primarily is what is called the unit specification, or US. And the reason I've opened this is because this is a useful document to help us understand how many assessment criteria are going to be there in the assignment brief, how many tasks will be there. So generally speaking, when we do any qualification, any course, what you're going to see is the number of learning outcomes that you study in a unit would actually translate into a number of tasks in the assignment brief. And when we talk about the learning outcomes, the assessment criteria that we see in each of the learning outcomes actually get converted into what are called tasks that we have to do, or question and answers that we have to do in order to do the assignment. So this is a useful document, which is what is called the unit specification. And the reason I say this is that the unit specification shows me, the indicative content that I need to be able to cover when I actually start writing the evidence as a Word document or as a PowerPoint presentation for my assignment. So it acts as a bit of a cheat sheet and gives me some indication of what is required to be done in the task. So if I look at, just as an example, a very brief example, there is a bit of a scenario given. We will go into detail. But when I look at the task and I look at the first bullet point, it talks about explain the current overall structure of health and social care setting. And if I look at this particular bit, it talks about the overall structure, of what all we need to cover when we look at this task. Now, how do we identify that this task is matching the learning outcome one? If I scroll down onto now this particular document, which I'll also mention right now, this document that we are looking at is called the assignment brief, or AB. The reason is this is the assignment brief which every learner would need to look at and then attempt to be able to complete and achieve this unit. Now, when we look at the assignment brief, and if I scroll down on the assignment brief, as you can see under the tasks with the bullet points, the learning outcome and the assessment criteria are labeled or given. So if I scroll back onto the unit specification on this side, if you see it says explain the structure of health and social care sector, the naming and the writing of the task pretty much remains the same. As you can see, it does not change. Explain the overall structure of health and social care sector. And here, the context has been added, which is giving examples of key elements of provision. But if you ask me honestly, the task remains the same. So we know that this is task 1.1, and this can be confirmed in the assignment brief because it says the three bullet points, 1, 2, and this third one, which is the table shown, are basically assessment criteria as 1.1, 1.2, and 1.3. Now, because this qualification is graded, the extension activities, which is the merit and distinction activities, are labeled as extension activities on your assignment brief. Now, if you can see, there is one merit opportunity here, and that merit opportunity is written here. It says produce a flowchart showing possible health and social career pathways. And again, this bit has been converted into a task here. And the distinction, there is one distinction criteria, and that has been given here. It says produce an evaluation of a structure of a named organization, which is pretty much the same wording as the unit specification. Now, I would suggest, as a thumb rule, what you need to do is download this particular document, which is the assignment brief, and then start looking at doing the assignment. That is what we are going to do. The unit specification sometimes tends to be helpful because if I have studied this unit and if I forget that what was covered or what was discussed under this particular topic or assessment criteria, then it is sometimes easier for me to scroll down and see the indicative content, which gives me a clear, insight into what is required to be covered in that particular task. Now, what I have done is looking at this particular unit specification and looking at the assignment brief, I, for the purposes of discussion, have converted this into what is called a PowerPoint presentation. The assignment brief is exactly followed, but what I've done is I've developed it into a bit of slide some slides for the purposes of discussion that we want to do and give you some pointers in terms of how we are going to go about, actually writing the assignment. So we will discuss this, but most of it I have converted, and looked at the indicative content, giving you some tips, and we are going to discuss using the PowerPoint presentation. But at your end, when you look at doing this after this session, when you start attempting the assignment, you should have all the three things with you. You should have the unit specification, you should have the assignment brief, and you should also have the PowerPoint presentation, so that it is, you have all the things available to be able to start your assignment confidently. Now, when we look at discussing the assignment brief, what I would want to do is start off with certain important tips. Now, these tips are, mentioned here because what I want you to do is get your assignment and your evidence right the first time. We don't want to be in a mode wherein you create a draft, you send it over to us, we look at it, and then again go back and say, okay, you need to do this, you need to do that, or you haven't followed this task, or this task is not attempted. What we want to do is look at following the assignment brief, which is to say we are going to dot all the I's and we're going to cross all the T's. That means attention to detail is required, and that is why I have put these useful tips here. Now, our aim is to look at attempting the assignment brief, the task given in the assignment brief, and achieve the assignment and achieve the task in the first attempt. Now, one of the first tips which I want to very briefly give out is read the task carefully. So when we look at the assignment brief, in the assignment brief, there are a couple of things that you need to be aware of. And if I just switch you back to the assignment brief, if you see in the assignment brief, there is a scenario given. That means a bit of a context given for you to assume why you have to look at doing the assignment. So here it says, task 1 is the organization structure of health and social care sector. You have gained a job as an administrator in the hospital. You're embarking on an induction program. And at a recent meeting with your line manager, you were informed that health and social care sector is one of the largest employers in the United Kingdom, which is absolutely correct. There are in excess of 240,000 jobs, which are, between nurses, doctors, therapists, any sort of practitioners which work within this sector. And this is one of the largest employers in the UK. And this is direct jobs within the health and social care sector. Obviously, there are jobs in the private sector, ancillary sector, and, associated partnerships and, other companies and organizations which work directly or indirectly with the National Health Service. The National Health Service includes public provision, private healthcare providers, and social care sector, which includes private, public partnerships and voluntary organizations. Now, in this assignment, you will start work on an induction program. So what is the context given to you? The context given to you is that you have been asked to work on what is called an induction program because you've joined as an administrator in the college. So sometimes, if I say to my kids at home, can you do this? They come back to me and ask me a question sometimes to say, why are you asking me to do this? Or how should I do this? Or they have certain questions in their mind. And the questions are because they want to know a bit more about it so that they can complete that task successfully or achieve it in a way wherein it helps achieve the objective. So similarly here in the assignment brief, the awarding organization has given you a bit of a background or a scenario, and assuming that, what you have to do is essentially the assignment. Now, this induction program that you're going to be working on, it will require you to build. Now, essentially a file would mean that you need to produce document on some information which is going to be useful for you in the future, which is like an assignment. Now, assuming this with a background, we get into task 1 and it says produce detailed notes which explain the overall structure, explain who are the watchdogs and regulators. Now, the reason I say that we need to read the task carefully is that if you see the first words of the task actually define what the task is asking you to do. Now, when I say command verbs, these are words which are going to tell you exactly what is required to be done in the task. If I delete this word for a minute and then read the task now, it says the current overall structure of health and social care sector, giving examples of key provision, of key elements of provision. Now, I don't have a sense of what is required to be done, what the sentence is actually saying, because I've deleted the keyword or the command verb. So here I can understand that it is saying overall structure of health and social care sector, giving examples. But what do I need to do this? What do I need to do with this? Do I need to describe it, demonstrate it, explain it, make it, create a flowchart? Because the main word has got deleted, that is where the sense or the purpose of what the task is asking us to do has been lost. So when I say read the task carefully, you should focus on picking up the command verbs in the assignment brief. And this command verb has a definition. So there's another document that I'm going to share with you. And this particular document is called the command verb document. Because you have a qualification which is graded, the units on the qualification are graded, and you can differentiate your marks by achieving pass, merit, or distinction. You should also understand how much to write, how much is too much, how much is too less, and how much is the optimum word limit to be able to achieve and complete those tasks. So the command verb in the first tasks basically are explain. And if I scroll down, you would see that at some place it will show the definition of explain, right? Now, if I see in the pass criteria, if it was a pass task, which it is 1.1, it says explain. But when it says explain in detail, that means you have to go into a bit more detail of not just explaining the definition, the theoretical part of it, but also give reasons and evidence of why you are explaining a particular topic. So it is important to understand and pick up the command verb. That is why I focus on reading task carefully and then knowing the definition of the command verb so that you're able to write optimally to achieve that task. So it says set out in detail the meaning of something with reasons. More difficult than describing or listing, it can help you if you show or write an example. Start by introducing the topic, then give how and why. Now, if you cover this, it says explain the current overall structure. If I get somebody putting into the assignment brief and the Word document, just the overall structure of the NHS, that would not achieve that task. You would need to define and explain the structure as well. That means we will go into details, but that is where that part would help you cover this task. Now, the second bit, which I want to, so this document will also be available. Let's switch back to the presentation. Now, the second bit that I would say, and I've covered this up, you have to focus on command verbs. These are words which describe what action or what has to be done in order to achieve the task. And what I've done is I've briefly listed them here by saying that if you have explain, define, and describe these kind of words, which are generally pass words, pass command verbs, you're expected to write between 70 to 100 words. If you have access, examine, clarify, analyze, or explain in detail, then you're writing about 100 to 125 words minimum to be able to achieve that task. And when you have compare, contrast, critically evaluate, or critically analyze, then you will need to build arguments, talk about positives and negatives of that argument, make a decision of why you're supporting this particular argument, and then summarize that in 150 to 200 words. So as you would see, the command verbs give you some idea in terms of how much is to be written or what is the optimal content in terms of words that you have to write to be able to achieve the tasks. The next point, very briefly, is we are following Harvard referencing, which is also called the author date style referencing system. There's a presentation up on Moodle. Harvard referencing can be done through the Word document, and I'll explain that very briefly when we go into the details. And this is something that you need to keep in mind. Now, generally speaking, for somebody who's looking at achieving a pass, I would put it this way, that students typically end up creating word assignments of about 3,500 words. If somebody is looking at merit, up to 4,500 words, and if you're looking at distinction, probably up to maximum, I would say 5,500 words. The reason we want to keep the word limit in mind is because you do not want similarity or plagiarism to also increase in your document. So the reason of specifying command verbs and asking you to read the task carefully is to look at also mentally doing some calculation in terms of, if that's the grade I want to achieve, I'm mentally prepared that I should be looking at producing my work, which is going to be about 3,500 to 5,500 words. And sometimes if I academically write using referencing, using quotations, using in-text referencing, I can still achieve a distinction in 3,500, 4,000 words, because I am using arguments which are factual and something that I'm quoting from authors, publishers, which are established facts, and then referencing them rather than starting from scratch by building a context first and then explaining it, which would mean I need to write more. So rather than building a context, you can use a quote, you can use an in-text reference, and that would allow you to shorten your work because you straight away make a point and then you start explaining it. If you have to start explaining it, explaining the point itself, then build arguments, then you're going to be writing more. That is one of the first things that I want you to understand. Any questions on this so far? So if you have any questions, you can ask me through the chat route. If you are having no questions and you understand, give me a thumbs up so I clearly know that we can move on. The second bit, which I want to also focus on, is that when you do your assignments, sometimes when you look at your task, you will see that the tasks are only asking you to focus on theory. Or in some cases, they are going to ask you to show an application, which is to say demonstrate or complete. Those would mean that you will have to practically do the task. And in some cases, when it says the named organization, it will ask you to also, give an example. And let's look at the assignment brief again. Here it says explain, explain. Here it says complete the following grid. Now this is the grid. And if I scroll down, ATHE has provided us a format or a template of that grid, which we have to copy and paste and then use it in our Word document to cover the task B or part B of task 1. So it says complete the following grid to show different roles and responsibilities of a named health and social care organization. So as you will go into the assignment, when we go into extension activities, we go into task 2, extension activities, task 3, and extension activities, you're going to see that normally the first bullet point will always talk about theory. The second one will start to ask you about an application. And the third one will ask you to demonstrate with an example the theory and application of what has been studied in that task. So when you look at doing your assignments, you will see that the complexity of the tasks increases in this particular order. And this is also evident if we go into the spec sheet and look at it. You would see the first tasks normally cover explain, explain, explain. And then it'll go into what is called evaluate, a higher order command verb. Similarly, if I go into task or learning outcome 2, it says explain, explain, explain. Then I go into explain, explain. Then it comes to describe. So describing is more than explaining. And here, explaining the role of learning. That means it is asking you to specifically explain something. So it is increased in complexity. And then you have assessing the potential. That means you have to give relevant arguments, positive and negatives have to be discussed, advantages, disadvantages have to be discussed, and then you have to come to a conclusion. So as you will see, the complexity of the tasks sometimes increase from top to bottom. So you would see they will normally increase from top to bottom or from pass to the distinction criteria. And this is also because it is giving you an indication that at some stage you are only required to explain theory. In some, it will mean application. And in some cases, it will ask you to elaborate with the help of an example to show your understanding. Now, some of the tasks that we're going to see in the assignment brief will say a named organization. And that named organization would mean we'll have to take a care home. We can't take the NHS, which is very big, as an example. You might take a care home or a surgery or a pharmacy or a community healthcare center. And that would be optimum for the usage of, and as an example within the assignment brief. Sorry. Now, this particular assignment has two different assessment types. If I look at the assignment brief in carefully, what I will see is that it is asking me to produce two different kind of outputs. One, in task 3, it is asking me to do a presentation slide, which is going to be a PowerPoint presentation like this. And task 1 and 2 are going to be looking at creating a Word document, and that is going to be report writing. That means essentially I will be required to, create a Word document, and that would be for task 1 and task 2. So it is important, if I look at the Word document, to basically skim through the document first, very briefly, and then understand what is the assignment asking me to do, what kind of an output document it is asking me to produce. So when you submit an assignment for this unit, what will come to us for the purposes of marking an assessment is going to be two documents. One will be a Word document consisting of task 1 and 2. And the second part is going to be a PowerPoint presentation, which will be with some speaker notes. And I will very briefly show this to you here, where it says in task 1 and task 2. So task 1, if I look at, it is asking me to create what is called an information pack or a file. And these are going to be Word documents, as you can see, using this great Word document. And then when I go to task 3, it clearly would say produce a PowerPoint presentation. And this PowerPoint presentation will have some notes, explanation of slides, which are done underneath the slide. And that tells us very clearly that what the output of the assignment is going to be. So here, when I look at the slides, I can put some of the points that I need to explain in the section, which is called the speaker notes section under the slide. And that would help me accomplish task 3. Is that okay? Is that okay so far? Everyone is clear on this? Right. Now, if I go to the scenario, what we are going to look at is, this is the scenario that I've copied and pasted from the Word document of the assignment brief. And it says you've successfully gained a job of an administrator. Now, some of you have working experience of working within the NHS or some sort of a health and social care setting. Now, if you feel at any stage that you can use your own employment, your employer as an example to do the assignment, whereas not using the the criteria or the scenario given in the assignment brief, that is absolutely fine. But what I will do with this would be, when I start my Word assignment, I am going to basically do a bit of an introduction. And in that introduction will tell me and inform the assessor that I am not going to use the scenario of the assignment brief, but I'm going to use my own experience and my place of work, anonymized in a different name, and then use it for the purposes of completing the assignment. That can also be done, not a problem. Now, task 1 says, explain the current overall structure of the National Health Service. And, in this case, it is saying giving examples. So I'm assuming that I'm going to be talking about the National Health Service. And what I would do is primarily look at, then talking about this structure of the NHS. So here, what I'm going to do is primarily look at copying this task from the assignment brief. I will place it onto the Word document. And when I place it onto the Word document, I'm going to start then explaining the overall structure of the National Health Service. Because it says giving examples, you can say the structure of a care home, a surgery, whichever you are comfortable with. But at some stage, you will have to explain, what you are looking at, covering within the task 1. So here, the tip is You have to look at the LO1 presentations to cover the overall structure of the NHS, should you wish to do NHS. And you can give examples of provisions like GP surgeries, hospitals, or community centers. So if you recall, we discussed the Vidinshire Hospital. We've looked at its website. You might be comfortable putting a structure of a hospital, which is Vidinshire Hospital, or any other hospital that you're aware of, and that structure. And overall, you can go to the website, get that structure from there, organogram, and then put it on and then explain it briefly in terms of what are the key parts of the organization, that you are looking at, explaining. So here, if I look at doing the assignment, what I'm going to do is I'm going to look at showing you a Word document right now. And this is going to give you an idea in terms of how the assignment is to be produced when you start doing it at your end. So what I've done is I've looked at a new document. In this new document, a couple of things that I'm going to do first is what I will do is write my name first. I'm going to also write the name of the unit, Health and Social Care Sector. After I've written the name of the unit, I am going to do some formatting. I'm going to insert a page number in this so that as the document increases, number of pages, I've inserted a page number here. I put my name, I put the name of the unit. I'm going to start with a bit of an introduction in terms of how you're going to write the assignment. So you're going to say, I am going to present the assignment for the health and social care sector in two parts. Task 1 and 2 are going to be a Word document report, and task 3 is produced as a PowerPoint presentation. I am not going to be using the scenario given in the assignment brief, and use my own organization, or let's say use my place of work organization as an example to cover the tasks given in the assignment brief. So what I've done is I have chosen not to take the organization or the role given in the assignment brief. I am currently working and as a health and social care worker with the NHS. Now, assuming if I'm doing so, I mention what I'm doing and what is my role, and then what I will do is start doing this particular task. Now, what it requires me to do is essentially create, a structure. In this case, if I look at the structure of the NHS, or in this case, say, for example, if I'm looking at the structure, say, of Vidinshire Hospital, assuming I'm familiar with the Vidinshire Hospital. So what I want to do is basically look at the structure of the Vidinshire Hospital, and that is what I'm going to be bringing into my, in my assignment brief. So what I can do is I can go to the Vidinshire Hospital website, and there on the website, I'm going to try and find an organogram, which basically shows the structure of the organization, which is the management structure of the organization. And that would be, and this is something which I brought in from Google. So I've looked at the organization structure of the Vidinshire Hospital as an organization. And what I now want to do is cover this task up by explaining the key, parts of the organization here. So what I've done is I've looked at some of the key parts of the organization, and that is the bit that I've written or covered here. So there are different, sections. Informal care, there's a bit of private provision, there's a bit of public provision. And what I've done is I've explained the health and social care structure here, and this helps me in covering this task, which is 1.1. And it says explain. So what I've done is I've created a bit of an organogram. I put the organogram here, and then I've explained the key parts, the clinical care groups, the public provision, the private provision in the hospital, and the care which is provided. And that helps me, complete that side of things. I can also use a different chart depending on, what you can find on the web. Now, in some cases, sometimes there are pictures or charts or images that you can find, and that would be, maybe more useful. And you might have to do a bit of research. So I have just done a quick search of the organogram of the Wythenshawe Hospital in Manchester, and let me see what comes up, if I can get a better structure of it. And that is what I would try and put across, for the purposes of explaining, the structure of how the hospital and the services are structured within Wythenshawe. And if you are looking at a care home, say, for example, a care home in Manchester or a place of your work, you can use something, as a structure to explain, the care home structure as well. If I delete this for a minute and I drag something in terms of a structure of a care home, and you can show this as well and explain the structure, and that would help, cover it up. But because in the assignment brief, it is talking about the overall structure of health and social care sector, it is going to be important for you to have this organogram, which is going to be the organogram taken from the .gov website. And that particular organogram from the .gov website helps explain the overall structure of health and social care, within the UK in particular. And that is going to be, important and necessary for this task. That is where we will need to read the task carefully, because it is saying overall structure of health and social care. When it comes to a named structure of an organization, I can use a care home, I can use Wythenshawe Hospital, but here I have to use the overall structure, and that is what I need to explain, and this would help accomplish this particular task. Now, similarly, when I go to task 2 and I copy it from the assignment brief, this is the task 2 given, which says explain, what does it say? Explain who are the watchdogs and the regulators, as far as, the health and social care structure is concerned. So in this case, when we look at the structure, what we are looking at is primarily talking about, talking about the regulators. Who are the key regulators within the national, healthcare service within the UK? So if you go into the slides of the presentation of Learning Outcome 1, if I bring you to the slides, here we have discussed in bullet points who are the key regulators. You have CQC, you have the National Institute of Care and Excellence, you have various chartered bodies like the General Medical Council, you have various bodies like the, Nursery Midwifery Council, and these are required. A couple of them would be required to be covered. Healthcare Professional Council, HCPC, a couple of them would require here to be covered in order to meet the task criteria. Now, if I look at, explaining some of these, Public Health England, for example, is one of the bodies. You could look at picking out examples that you feel you are aware of by doing your research, and they would absolutely be fine. So if I take you back to the document, what I've done here is I've talked about who are the watchdogs and regulators. I've looked at the CQC, the Healthcare Inspectorate in Wales, Public Healthcare Inspectorate in Scotland, the Quality Authority, the National Institute of Health and Social Care Excellence, and that would help me accomplish task 1.2. Similarly, if I go to task 1.3, which is given in the assignment brief, and for that, we have to use a table, which is given in the assignment brief. And here, what we have to look at is the roles and responsibilities of staff in the named organization. So if I bring you back to the presentation in the assignment brief, as you would see, here it says 1.3 different roles, and the main focus is a named organization. So here, when I say a named organization, what we'll have to look at is we have to very clearly take an example organization. So when I say named organization, we are looking at, a care home in particular. So you will have to very clearly mention, the name of a care home, and then go about, talking about the roles and responsibilities of staff within the care home. So this is an important aspect wherein you need to understand that it is asking you for a named organization. That means we have to take a care home to be able to, essentially complete this part of the task. You won't be able to do it generically. You'll have to make sure that, you talk about the roles and responsibilities of staff within a care home, things like a compliance manager, a practice manager, health and social care workers, healthcare assistants, clinical nurses, a doctor, which is, a residence doctor, and they would be done using a table here. So if I have to look at, roles and responsibilities of staff in a care home in Manchester, that would mean that I've taken a named organization, and what we need to do is we need to do this as a table wherein it explains the table, has the job title, it has the main responsibilities as it is given in the template, and then what qualifications are required to basically take up that role or work in that role. And then that would basically make this task or help us complete this task completely. So how would I go about doing it? I will copy and paste this table from the template which has been given, and I'm going to basically look at using it for the purposes of explaining the roles and responsibilities of the care home, say Asha's care home in Manchester. So I've just taken a random name and I say I will be explaining the different roles and responsibilities of staff in Asha's care home in Manchester. And then using that, what I've done is I have created a table, and that table helps me put this into a bit of context to say that this is, the role, this is the title, and then with this title, this is the qualification which is required for the person to be able to work within that role. And that has helped in, let's say, presenting this particular task, which is required to be done in a tabular format. So if I just reformat this slightly, that helps me cover this particular task. So I have covered the job title, care manager, registered nurse, care assistant, activities coordinator, chef and cook, housekeeping staff, maintenance staff. What are the main roles and responsibilities? I put it here. What are the qualifications required to work within this role? That has been mentioned here. And this has helped me complete task 1.3. Now, for the next task, if I go into the assignment brief, I will need to show, if I switch over to the presentation again, We need to look at, the next task, which is the merit task. And the merit task says, produce a flow chart showing various career pathways, within the, within the health and social care sector. So what I'm going to do is copy and paste this task. And then the key bit which I want to show you is how to look at, putting this in the assignment. So when I go back to the document, and as you can see, what I will do is, because I need to show a flow chart for career pathways, I'm going to basically look at going to the Word document, going into layout, choosing a break in page, and then changing the orientation to landscape, which allows me to have a page wherein I can put a flow chart in a bigger space in a landscape mode. And then I'm going to look at this career pathway flow chart, which basically explains how people can work within the health and social care sector. Now, this is a chart which has been taken from the website Google. And what you could do is, because the chart is asking you to create a flow chart, one is, this is a generic flow chart I've taken. The other bit would be, I could create a flow chart by just covering the roles and the responsibilities of the care room that I've taken in the previous task 1.3. So keep it short and simple. What I could do is I could drop a flow chart here, which shows that I would normally start, and some of you will have to use your IT skills here, because obviously it's a case of, when you do the assignments, you're looking at obviously sharpening your IT skills as well. And here, what I would do is basically use a couple of text box and shapes here to drop a flow chart. So what I'm going to do is draw a couple of squares. So this is one example, then copy and paste this. Again, copy and paste this. Again, copy and paste. So I'm just going to show it for the care home, because we don't want to show a very big chart, but the task idea is to complete this task in terms of showing the career pathways and opportunities of how you progress from one role to the other. So here, what I'm going to do is now, I'm going to start in as an administrator, as an administrator. And after a couple of years of working, what I would do is basically move from the administrator role, to a different role as I increase my qualification and, my experience. I'm just going to copy and paste a couple of these arrows here. Right now from the administrator, so what I'm going to use is this part here. So if you started up building your career, starting with housekeeping staff, then you move to the activities coordinator, the care assistant, you start doing a course in health and social care, and then you slowly and gradually, become a health and social care worker. And that would basically be shown here. So that would show you a map or a flow chart that you have created to look at showing the possible career pathways when you start to do continuous development in your role within this sector. You are able to also progress to higher roles within the organization. And that would be the case of actually drawing up this merit activity. Now, once you have done this, what we want to be able to do now is go back into, the document again. And what I want to do is essentially, so let me just, 1 second. So what I want to do now is insert a break again. In terms of the layout, I want to go back to the portrait mode again, next page, and orientation portrait. So that would mean the document here would become a portrait document. And we'll go back into the actual page of doing the assignment. So I'm showing you, in a way, some soft skills as well in terms of how you would go about, doing the assignment when you actually, are doing the assignment yourself in terms of for this unit. So let me just go back in. And here I'm going to change the orientation to portrait mode again. Now, What I would do is, one thing before I do anything, I'm going to do is insert page break, then go to layout, change the orientation, and hopefully that should change it properly. Or I could essentially, one second. Yeah. There you go. And then this bit I will change here, then do a break, and then change the orientation to portrait. So as you can see, this document now is coming into shape in the form of an assignment evidence that I'm creating. Similarly, I will go to the distinction task where it says produce, an evaluation of a structure of a named organization. So what we have done is we have done the evaluation of Asha's care home, and that bit, would be explained in a bit more detail to cover the distinction task, and that would be it. So here, what I'm going to do is put these two tasks together, right? 1D1. And because I put the structure in, I don't want to be repeating myself. So what I will do is explain the roles of the structure of the organization. So basically explanation of the structure of the care home, and that would help complete 1D1 as well. And similarly, what I will do is I will go into completing the additional tasks of the assignment brief when I look at going through task 2. So when I go to task 2, so in task 2, we've got to cover now some of the relevant pieces of legislation and codes of practice. There are 3 tasks given here. I'm going to copy this onto the Word document pretty much straight away without and then what I will do is, in order to complete task 2.1, I've given some tips here that you need to refer to the Learning Outcome 2 presentation, and that has all the various acts that we have covered that can be implemented and are useful for the health and social care setup. And those are the bits that you need to cover here. So here, when it says a list, I could actually do a list like a bullet point, small paragraphs, or I could also do a table. And you have to think intelligently to be able to do this, because at the end of the day, what you want to be able to do is accomplish and achieve the task. It is asking you to list, and that is what I would suggest that you need to go in and you list those important bits of legislation that we have covered, to complete this side of the task. So if I show that to you in a Word document in a second, you would see that, I have covered these by doing small paragraphs, or you can actually also do this by the aspect of actually covering them, as a table. So let's put this into a bit of context. And, this is a theoretical bit. So there are, it's not difficult. All you have to do is refer to your slides and the additional documents that I've given, and then basically using them, just about, I would say, write them in your own words, paraphrase them, and, reference them. So give me 1 second and I will show the output so that we are able to use it and essentially, provide it for the purposes of, completing these tasks. So the next one, which basically we look at, is the one which is showing the impact of current legislation on a particular setting of choice. So here, what we need to be able to do is, cover some of the main bits of the setting in terms of, an organization where you are actually going to show one of the acts or legislation which is being implemented, in a particular setup. So that is going to be important. And when we look at this, what we also need to be looking at doing is also building references up as we go along, because some part of the work that you are actually writing or creating needs to be referenced. And when we look at the impact of current legislation specifically in a particular setting, what we want to be able to do is essentially use the setting of a care home. So when I say particular setting, so what you could do is basically take an example of the place of your work, or the example that you've taken in the assignment in the start of introduction. So we have taken, Asha's care home, and that would be the bit that you can explain how some of these acts and legislations are actually, applied in Asha's care home specifically for, completing this particular task. Now, if you struggle and, you struggle, for example, finding a particular care home or a setting, which means basically a named organization, then my suggestion would be to look at using the internet, doing a bit of, search. And that search that you do is to try and find an organization that you can research on, that, it is an organization which exists, there's a website, and you can glean some of the information from there. And that would be putting it in the context of, the example that you can use to then complete that particular side of the task. So here in this case, when we talk about, the Asha's care home, so you are going to be looking at various aspects and, the various, let's put it this way, the settings, the legislations that you're looking at explaining from a point of view of the key acts that we have covered in task 2.1, and that would basically be then reflected for the, task 2.2. And then if I show you the task 2.3, how would I go about doing it? It is basically talking about, the explaining the UK care certificate and how basically, the 6 C's of care are used in the implementation of providing care to patients within a particular, setting or a setup within the NHS. So here I would suggest that we basically look at explaining that in the same organization that you've taken up as an example, just to keep it consistent. And these 6 C's of care would include, training and development, would include, person-centered care, would include collaboration and communication, health and safety, continuous professional development, things that we had covered, as far as the discussion was concerned in learning outcome 2. The merit task talks about, identifying the relationship between health and social care values. So here you have the person-centered values and the care values, which I've explained. And what you need to be able to do is explain these to cover the 2M1 task, which is required to be done for the assignment brief. And the explanation of these values, the comparison between the two of these values would essentially help you, complete this merit criteria of the task. So sometimes a table is more apt to be able to do it. That's why I've suggested a table. In some cases, you would be required, to essentially look at doing it as a Word document or as a report. Now, what I would suggest is you also need to reference your work. And here, in terms of referencing, your work, you need to look at sites, websites, articles, journals, that you are referring to. And those have to be, essentially mentioned towards the end of your document. So if I look at some of the bits that I am looking at from a point of view of, the documents that I'm referring, and while I'm basically, writing out some of these tasks, I would need to reference these and provide references so that my work is, actually seen as factual work. So when I look at, some parts of this that you mentioned in terms of references, it is important because this would mean that you're giving credit or due credit to the people for which you are actually, taking the work. And that would be useful from a point of view of establishing that this is your own piece of work rather than, work which has been copied and pasted. Now, Before we go into task 3, which is a PowerPoint presentation, let's very quickly look at how the Word document is shaped up in terms of doing this particular assignment that I'm explaining how we are looking at covering this. So if you see, we started off by explaining the structure of the care room. Then we looked at task 2. So here what I will do is basically put task 2 as heading, that this is task 2. And then task 2.1, I've explained some of the key acts, which are acts that we have studied, legislations we have studied, and these are mentioned, with regards to completing this task. Then task 2, we applied these aspects into the ASHA care room. So I looked at some of the key regulations and acts which are applied, in the care room. And we've covered that. We don't need to cover all of them, but just as an example, because it is asked for to be done in a named organization, we have done it. And in 2.3, it has asked me to compare the values which are person-centered, healthcare values in the 6 C's. And what I've done is I've done small paragraphs of these to explain why they are important. And then the relationship between the healthcare values and the care values, I have done a quick bit of few paragraphs to explain how they are related. You could also do a table, and this would help basically cover, the bit in terms of the assignment. Now, once I've done tasks 1 and 2, what I've also done towards the end is I've built references up of where I've taken the material from, and I've appropriately referenced the material, and I put the references here, and that helps complete, the first part of the assignment, which is tasks 1 and 2. Now, what I'm also going to do is the organization used for example and discussions in the assignment brief is ASHA's care home. So I've explained this so that when I get your assignment and I start assessing it, I clearly know that this is what the student has done and this is how the assignment has been done. Now, what I will do is format the assignment. So I'm going to go in and obviously do a bit of formatting on the assignment, give it a bit of structure, make a table of contents so that when the assignment is actually presented, I clearly know that you have attempted all these tasks and what tasks you are looking at, what grade actually you are attempting to be able to take it forward. So 1M1. So I'm labeling them nicely so that, they are going to come up in the table of contents. And as you can see, you can draw this up using your Word document and use a bit of your IT skills to present your document and the assignment professionally for the purposes of marking and assessment. So it makes it easier also, for me as an assessor to identify that you have attempted all these tasks and there is enough evidence and proof that has been, provided, and that would be useful. So if I look at formatting the document, I normally use font size 12. I would normally use Calibri or, Arial font. And then what I will also do is use a line spacing of 1.5, which makes the document nice and presentable, easy to read and easy to see. Now, wherever I've used pictures, what I need to be able to do is give the source of the picture. So source, this is the NHS, this is the Health and Social Care Department sector, and the source that I've used is www.gov.uk/NHS website. So I need to be able to mention the source of anything in order to give reference, and this is a part and parcel of your referencing. So I will say figure 1, and then I would mention the name of the figure and then would mention the source here, and this then has to be brought towards the end in your references, and that would be covering the figures or any such images, pictures, diagrams, flowcharts that you have created. They're all given in this part of the assignment brief. So they can be added as appendices or essentially included as a part of the reference, which shows that you are actually attempting all the relevant parts of the assignment brief. So that is where this would be summarized. And what I will do is, this now becomes your assignment. Let's drop a table of content. So I go into this, and then what I am going to do is just basically create the table of contents, which is under reference. As you can see, it brings across all the tasks nicely. And that would be the first page, the heading, which is the assignment unit, or unit name, essentially, making it slightly bigger. I can see you've done all the tasks, 1.1, 1.2, 1.3, 1D1. So you're hitting the distinction criteria. And then we are going to go to the second part, which is task 3, which is asking us to essentially do a PowerPoint presentation. So here is where you end up completing the part of the assignment, as you can see, and that allows you to submit this by saving as a document DiHSC assignment sample. And I'm going to save this for the purposes of sharing it with you later, a sample document. And this, becomes something which is how you would go about, actually submitting the assignment. Is that okay? Is that clear? Is that understood?
Yes.
Okay. Now, when you look at one part which I want to show is when you look at doing referencing. Now, if you see some parts, I'm also correcting. I'm spell checking my document as well. Before I submit, I need to make sure I'm using UK English. My Word document is basically set up as an English, US English. I need to change it to UK English, and that is why it is flagging me, the errors which are coming up in the spelling or the grammar side of things. So when I look at changing my English to UK English, which is important, that is what you need to be able to do, and you need to spell check your document before you submit your assignment. So this helps us complete, the major part of the assignment for this particular unit, which is the task 1 and 2. Now, very briefly, if I look at sharing the PowerPoint presentation right now again, and look at creating the task 3, which is basically looking at, task 3 here. The task 3 basically says, produce a PowerPoint presentation which explains how health and social care sector work together. That's the main bit that we have to do. And what we have to do in that presentation is create 2 handouts, which are going to be further covering details of what are the benefits and challenges of working in, health and social care sector. And the second is how health and social care services are best delivered to patients. So here you have to refer to my presentation slides of Learning Outcome 3, which talk about multidisciplinary team and multidisciplinary team and partnership working, and they would help you complete the PowerPoint presentation. So what I would do in this case is, if I were to create a PowerPoint presentation for these 2 parts, I'm going to look at, assuming if this is the presentation, what I'll do is insert a few slides first, take a blank presentation, insert a few slides, and then first part I'm going to do is put a home slide, which will say what is this task that I'm doing. So I'm doing task 3, right? And it is health and social care sector. Now, in the next slide, what I'm going to do is copy and paste the tasks and the tasks which are given, so that I'm clearly aware that this is what I'm going to be attempting. So I'm just going to format this. I've just copied and pasted that from the Word document. And here is where I will just reword it. So I'm going to put the extension activities separately. Put this here, do a heading, extension, right, to merit, and one for distinction. Right, just format it slightly. So make it task 3 here on the top. So I know that when you present this slide to your tutor, which is me, you are looking at, producing everything which is given in this bullet points, and that is what will help us achieve task 3. Now, when I start doing the first task, what I'm going to do is basically what we need to do is produce a PowerPoint presentation which explains, the health and social care work sector and how multidisciplinary teams or the importance of multidisciplinary teams. So what I'm going to do is place that as a heading. This is the bit that I need to produce the first part of the presentation on. What is the importance of multidisciplinary teams? Now, assuming I have some theory and some write-up on multidisciplinary teams, and I want to write it down, what I will do is basically make some bullet points here. And these bullet points that I make here, I'm going to put them into a couple of slides because obviously this is, a part of the assignment. So what I need to do is make some detailed points which will allow me to achieve the task. And I'm explaining what are multidisciplinary teams essentially by putting together a couple of slides, which I'm formatting as well. And that would help me cover, the bit on the first bullet point. So what I've done here is used my handout, which I'd provided. And from that handout, what I've done is I've mentioned some of the reasons of why multidisciplinary teams are important within the National Health Service and how they help in the delivery of integrated care and, so the quality care, which is a part and parcel of, the parameters given by CQC. The second part of the task talks about that I need to identify the benefits and challenges of working in partnerships within, the health and social care sector. So here I could do a table, essentially. It's simple because sometimes it is easier to present these benefits and, advantages or challenges essentially as a table. And you could do a table in the PowerPoint rather than creating multiple slides. But whichever way you look at doing it, you are able to, do so. And again, here you will have to read and glean some of the points from the handouts that are provided. So, for example, from my handout, I'm going to be looking at pulling together a few points which are basically giving us the benefits. And then what I'm also going to do is list out some of the challenges which the NHS faces when it talks about working in partnership with the private sector. So these are benefits. And then what I'm going to do is include a couple of slides talking about, challenges as well, because the task is talking about benefits and challenges. So I need to talk about what could be the challenges. And we discussed a couple of challenges like cultural barriers, communication challenges, power dynamics. And these are challenges that normally, are faced when two organizations or people from different organizations actually work together. So there could be legislation related challenges, communication challenges, data protection challenges, resource allocation challenges. And those are bits that you have to discuss and, talk about here in terms of covering this particular part of the task. Now, you could do this also by doing a table. And the reason I put it this way, is sometimes it is easy to cover some parts of, the tasks, and we have to look at what output should I produce, which would allow me to put this information across clearly and in some context. So if I put a table like this, as you can see, these are the challenges which I'm covering. And what I can do is explain these challenges in a subsequent few 1 or 2 slides, and they would help me, the coverage of the particular task. And this coverage of particular task, then towards the end, what I need to do is obviously put references, because without references, your presentation is not going to be complete. So what you have to do is give at least minimum 6 Harvard references, for the tasks that you're covering, as even in PowerPoint presentation. And the reason I say this is that without your references, your work is not going to be factual and accurate, And what you have to do is basically provide these references to ensure that, they are genuine. Your work is referenced and it is genuine. And what I would do is basically put some references across, from where I've actually taken the work. So for example, if it is a website, if it's a report, if it's an article, you could put, or a journal or a book, you need to put some references in, and that would help you accomplish task 3. Now, when I've done this task 3, if I just, take this out from here and I put it into a new presentation, simply because I need to, submit this separately from a point of view of, presenting it, and then obviously, submitting it for the purposes of assessment. I would primarily, put a couple of things across, which I will show you. Let me just switch you over. So what I've done is I've put those slides, into a new slide. And what I'm going to do is put my name here. And as you can see, I've basically used and put this into a presentation format, which clearly says what task I'm covering. And these slides are quite detailed enough, so I don't need to write any speaker notes here. But yes, if you do bullet points and you explain them briefly, then you could put some part of the explanation of the slides underneath here in the speaker notes. So for example, if you need to put speaker notes, you can put them here like this. And that would help accomplish, your task 3, okay, of the assignment. So generally speaking, when I go into, for example, doing the assignment, and this is the PowerPoint presentation. So what I will do is label it accordingly, and that would help me complete this particular assignment for the purposes of, structuring it, formatting it, and then submitting it to the email. Now, before I go into, say, any further details, one of the main things that I have to show you is that where would you go about, submitting your assignment, and how would you get feedback for it? So if I switch you over to the main presentation slide that we were looking at discussing, what we want to be able to do is look at where will you go about and actually submit your work, and how would you get feedback for it. So one last bit, which I'll quickly cover, and that is pretty much it, and then we have done. So that is given to you on the last slide in terms of the assignment discussion slide. So let me switch you over to the main presentation. And this one here. So if you see the last slide, once you've formatted your documents, fonts size 12, line spacing, you've done a conclusion, made sure that you put your references and put bibliography. What you need to be able to do then is submit your work to us at litc@ukversity.co.uk. And because you've finished the assignment today, so the idea would be to try and submit this by 30th of May, within 2 weeks, so that you have enough time to be able to research and obviously then be able to submit the work to this email, litc@ukversity.co.uk. And then once the work is submitted, you also mention in your email what grade you're trying to achieve. So mention in the email the grade you are trying to achieve. Because if you're trying to achieve only a pass, you mention pass. If you're trying to achieve a merit, then please mention merit. Or if you're trying to achieve distinction, then please mention distinction, because the feedback that we provide to you on the assignment is going to be commensurate to the grade that you're trying to achieve as far as the unit is concerned. So assuming you've not attempted the extension activities, the feedback provided will be only for pass, simply because that means you've only attempted the pass task, and that is what we assume, that you're looking at only achieving a pass grade in the unit. So I hope with this you've understood how to look at developing assignments and obviously submitting them for the purposes of achieving the grade. And this would be a session that I hope is useful for you to follow through in the other units that you're going to study with us for the purposes of also doing the assignments. So next unit, next week, we will be starting is the person-centered approach. And that particular unit that we start would essentially be looking at, the last unit for you to be able to complete your qualification. Any questions so far?
Yes.
Any questions, please ask me.
Yes, sir. Good afternoon, sir.
Good afternoon.
Please, I would like to have the templates on WhatsApp.
Yeah, we'll send you these templates on WhatsApp pretty much straight away so that you are able to, obviously get them and then use them for the purposes of doing your assignment.
And again, task 1, task 2, task 3. I don't understand the content of task 1, task 2. I only understood that of task 3.
That's fine. So you'll have to go through the presentation and the discussion again, because I won't be able to summarize this for you now.
Yeah,
If you
please, can you
paid
drop it?
attention, you would have understood what we are trying to do.
Hello, please, can you drop it, the presentation in the WhatsApp group too?
Yeah, we'll put that in the WhatsApp group. Don't worry.
Thank you. Sorry, I think I submitted an assignment about 2 weeks ago on the learner course, like the learner work website, the email. I think the email is changed now.
What is the no, learner work or LITC, both of them are the same, don't worry, because sometimes we have two mailboxes to which we ask you to submit the assignment, not a problem on all. What is your name?
Abdul Rashim.
All right, okay. And which assignment did you submit?
I think for what's it called?
Sorry, which assignment was this, Abdul?
Sorry, I'm trying to figure out. I've forgotten the actual the headline. Sorry.
No,
I think it should be.
So last assignment that we have got from you is basically your communication skills assignment.
Exactly, yeah, communication skill.
Okay, so communication skills assignment, we'll send you feedback, before Friday. So
Thank you. I would expect.
Yeah, I've got it here with me. I'll make sure. I think if it has not already been marked and feedback has not been sent, you will get it before Friday.
Thank you.
No worries. Anybody else? Any other questions?
Yes, it's me, Sir Bushra. I want to ask, like, my assignment, I think this is the only one that remains for me to submit for all the assignments. The health and social care.
Mm-hmm.
Yes, I just want to know because I've already submitted like 3 before.
Okay, what is your name again? Sorry.
Bushra Smith.
All right, okay, Bishra, 1 second. Let me just have a quick look for you.
Okay.
Ideally, we should be, doing this discussion with our colleague, Jill, because she would be able to send pretty much, summary to you, or you can basically discuss with her straight away in terms of what assignments have been submitted, what assignments are pending.
Yeah.
And she
emailed me after later now. Yeah, she sent an email to me and I've told her that I've submitted like 2 before, like communication and the central approach, and I submitted the other one, which is
so your assignments.
Yeah, but she sent me the feedback about communication, but the previous 2 I haven't got any feedback, which they send it to put more FOL, additional, like, put more information, which I did. But I just want to know, like, it's only one. This is the only one that I have to submit and to complete my assignment.
Right. Okay. So basically, I've got the feedback for both of your units, and I can briefly show them to you. But obviously, because we've got other learners, so your communication unit, you've achieved merit. That feedback was sent to you on the 27th of March.
Yes.
And then the other unit, which is your unit in which you have done the. Let me just have a quick.
Approach.
You've done the academic research, academic and academic skills and academic writing and research skills. On that unit, we've got, you also received feedback, and on that unit, you also got a merit. The third unit.
But what about the center approach, sir?
So the third unit which you have sent, which is a person-centered approach, that unit, we had returned back to you on the 13th of February because the document and the unit which was submitted, let me have a quick look on that, was also marked. Yeah, on that you've got distinction. So this is the last unit that you're looking at submitting here. So these three are all available. I'll ask Jill to email you the feedback pretty much straight away for your records. So you have the marked assignment, you have the assessment front cover sheet, and they will be, proofs that you can keep at your end that you've completed this qualification. And once you submit this last unit, that is correct. That is going to be the last assignment for you.
All right, sir. Thank you.
No worries. Anybody else? Any other questions? Okay, that's fine. So if there are no more questions, what I will do is end this session today. Thank you so much for attending. I hope you have understood and enjoyed and obviously picked up some skills in terms of how to write an assignment, how to do the assignment, how to format an assignment. And for this particular one, which is the health and social care sector unit, we're looking at getting the assignments by 30th or earlier than 30th, and we will keep marking it and keep sending feedback to you. There are 3 bits which I will share with you shortly on the WhatsApp group. They would be essentially the PowerPoint discussion for this particular presentation. It will be followed by, your assignment sample, and then also followed by the assignment brief so that everyone has the assignment brief to be able to attempt this particular assignment. Thank you so much for joining, and we will send you the schedule for the next unit later today, which will be person-centered approach, and that unit will be starting next Monday, 11 a.m. and Tuesday, 11 a.m. the same time. Thank you so much for joining, and bye for now.